Welcome back to Indiana News Desk. President Donald Trump's proposed budget calls for repeal and replace of the Affordable Care Act. It seems unlikely that Congress would make such a move as early as next year, but still the future of the ACA is in jeopardy. That leaves millions of Americans who rely on the ACA for health coverage in a nerve-wracking position, especially those who are dealing with diseases that are among the most costly to treat. Tyler Lake reports.
This is my little nephew. This is my son.
Charmin Curry is showing off pictures of her kids and grandkids displayed on a shelf in her new apartment. In one frame, just as large as all the others, there's a photo of former President Barack Obama. His landmark legislation, the Affordable Care Act, provided the funding that allowed Charmin to get treatment she desperately needed when she got sick last year.
I was diagnosed last year in February with lobular carcinoma. It was stage 1 until I had the surgery. They took out 5 lymph nodes in my left arm and removed half of my left breast.
The diagnosis couldn't have come at a worse time. Charmin had recently lost 2 brothers, and while getting treatment, was struggling to cope with the death of 2 of her sisters.
It was just really stressful, to be honest with you. I thought I was going to die, you know. That was just a big part, just always stayed in my head. It just took all of my energy, just kind of like killed my spirit.
And her reaction is not unusual.
A cancer diagnosis is devastating on many levels. It's not just the medical aspect that we look at. We look at the emotional impact, the financial impact, the spiritual impact.
Helping people deal with the fallout of a cancer diagnosis is what Deanna Wesley does for a living. She says without health care coverage and a support network, many people don't make it through diseases like cancer. That's where Charmin is lucky. In 2015, she was registering for SNAP benefits when she noticed she could also sign up for health care coverage through the Healthy Indiana plan. Charmin wasn't sick, but she went ahead and did it anyway. That decision would change her life.
I don't know where I would be right now. I don't know if I would be healed, you know what I'm saying? Because like I say, the cancer is gone, and without that insurance, I don't know where what I would have done or where I would be at this point, to be honest with you.
Aparna Soni is part of a research team that's been combing through data since the Affordable Care Act was implemented.
We found actually large improvements in insurance coverage among people with cancer. So the uninsurance rate, meaning the percent of people who lacked health insurance coverage among the cancer patient population, it went down by about 1/3, which was quite a large decrease, larger than what we were expecting. And a lot of this was driven by states that chose to expand Medicaid.
According to her research, about 6% of cancer patients had no insurance before the changes. But in states like Indiana, where Medicaid was expanded, that dropped to just over 3.5%. That might not seem like a lot, but it cut the number of people suffering from cancer without insurance by around 30%. And that's important. Wesley says simply having insurance might be the difference between ignoring a problem and going to the doctor for a diagnosis.
So once the problem or the symptoms become so severe and they get to us, it's usually pretty advanced, which is sad. You know, we've had women that have come here and their breast cancer has been so advanced that it's literally growing out of their skin. You can see it.
Charmin didn't put it off because she had coverage. At the time of the diagnosis, she wasn't making nearly enough money to cover the medical expenses and all the other, sometimes hidden costs of a cancer diagnosis.
Because I don't know what I would have done, because they took care of mostly everything without, me paying out of pocket.
Charmin still has coverage through the ACA, but she's worried about losing it. The recent Republican tax bill will roll back the individual mandate starting in 2019. That means fewer people will be paying into the ACA, and as a result, premiums are likely to rise. President Trump has also taken several measures to weaken the law.
So there's certainly a lot of uncertainty when it comes to the Affordable Care Act. There's been so much back and forth in Congress about parts of the ACA potentially being repealed. And what our results imply is that if we were to reduce funding for Medicaid or remove protections for people with pre-existing conditions, then we might see drops in insurance coverage among people with cancer.
To be honest with you, I don't know how I would deal with it. I mean, I'm just glad that I did have the insurance to cover it, but if I didn't have that insurance, I'd probably be a basket case all over again because I was in pretty bad shape.
For Indiana News Desk, I'm Tyler Lake.
Indiana's Attorney General Curtis Hill is one of 20 state officials attacking the Affordable Care Act. If successful, the lawsuit could mean the end of federal support for Indiana's Medicaid expansion, which is funded through the Affordable Care Act. That could impact approximately 250,000 low-income Hoosiers.